sympathise with all three of you, because it was the same scenario for me. You know, being a solo parent, you know, trying to figure out what role you need to take at what time, and you know, who are you? You know, you go to work, and at the time, my managers were actually off sick with COVID symptoms, so I stepped up I was deputising, so I had all the emotions of the staff and their anxieties and worries that I had to deal with and make them feel okay. I wasn't even allowed to have an emotion, but that emotion came when I got home, and I wasn't sleeping, because I knew that I had to be right for absolutely everybody in my arena. I knew that I had to go to work the next day because there was no senior management, that I had to be able to give the staff the information that's required. Even though you were told them this 100 times and over, it still wasn't enough. It's like I hadn't spoken, which I understand, because if I was on the other side and someone was telling me about a disease that nobody has no idea about, and every day we're learning about this, but it's also about how do we protect ourselves, how do we protect our family, what were the symptoms, because the symptoms had changed so many times, you know, how do we work, you know, we didn't have social distancing at that time, but, you know, everyone was getting some kind of symptoms, like, oh, I've got a runny nose, is that it? You know, call 111, people were going off sick, people self, it was mayhem. But what I found for me was, I was trolling Instagram, as I do, like, more than I should really, and one of the people that I follow, which is Ziva Meditation, they were actually offering free their meditation package, which is a 2-week meditation course for free for healthcare workers. And I'd done this before, and I actually paid for it, and I did benefit from it. So I thought I would employ that into my routine, because I just needed to de-stress. I could just feel myself. The adrenaline was just, you know, I was in that fight or flight mode constantly. So I just employed meditation, and after that first session, I just felt so much better, and I just did that continuously for 2 weeks and still doing it, and that helped me de-stress, so that I'm there for my family.
Sorry, and it's really, and these are the things that you're like, when are we going to ever even come through this unscathed? Because now that things are appearing to be calming down, because the admission to hospital now is reducing with COVID symptoms. However, now that the country is starting to function where people are going out, we don't know, because there is going to be another surge. But when, you know, and as when more services are reopening, because now we're starting to reopen some services, other services, because during COVID, you know, a lot of surgeries operations were cancelled, outpatients, appointments, etc. They were all nil, more or less, because we needed those staff in ICU to work. So now when those people are redeployed back to their home units, etc., the public are not seeing any of this. And to say, you know, you still need to maintain social distancing, some element of it, or even put on a simple face mask. You know, you don't have to wear the full-flown PPE that we wear in hospital, because nobody's going to come up to your face. But at least just be aware. And when I look, you know, I'm coming from work these days, and you see the parks are really full. And even pre-COVID, I've never seen so many people in a park or in a space pre-COVID before until now. And I'm like, are people really not taking these things seriously? Because the guidance have changed so many times since COVID, and they're still changing.
Sorry.
My sister tested. Originally, my sister had a cough, and she was pyrexic, high temperature, for about a week. But she didn't really say anything, and she had the flu about a month before. So we still thought she was recovering for that, because she also tested positive for that. She went into hospital with chest pains, shortness of breath, pyrexic, high temperature, and a cough. And whoever saw her, she's also got sickle cell disease, whoever saw her said she's got muscular pain and sent her home. So they didn't test, because at that point they weren't testing patients coming into A&E. Then a couple of days later, she was saying to me, I really can't breathe properly. So I had to listen to her chest, and lo and behold, she had reduced air entry, lower base of both lungs. So I said to her, go back. She went back, they tested her, she was actually positive. However, within that week, we all started, there's probably about 8 of us who locked down in the one home. A couple of us, including myself, started to become unwell. So I had the cough, had a bit of a temperature. My symptoms varied and I struggled over 4 weeks, but initially it was the cough, the temperature and the sore throat. I also had a little bit of nausea, and then one day I woke up and my taste buds had completely gone. So I left it, and I thought, well, and then my mum was really unwell actually, and my daughter. So I thought, well, it's probably that because we're all in the same home. But by the time I got tested via the hospital, not as a patient, via NHS, it was negative, which I thought would be the case because you tested me 4 weeks after the initial symptoms, so it came back negative. So I guess now it is about waiting to have a serum test to confirm that, yeah. But like I say, we all of us in the home. However, my son didn't have any symptoms, which was quite interesting. Didn't have any symptoms at all. But I know yours was quite similar, wasn't it, Veronica, with your symptoms?
Yeah, the only symptoms I had was I had temperature, continuous temperature for like I think about 4 days, and then it was on and off, intermittent, and then I had headaches. I didn't have any cough at all. So I got tested day 5 of having the presentation. So it was day 5, and it was negative. But then after day 5, I started having temperature again, but it was on and off. And then that was it. Then I developed cough. Then my cough was productive. I was having a yellowish phlegm. It wasn't dry cough that obviously was one of the symptoms. My one was productive cough. So I started taking antibiotics and they helped. The sputum was, I think it was yellowish color, but then after taking antibiotics, it was clear. So they thought it was more to do with chest infection than anything else, even though the symptoms were similar to the COVID symptoms. It wasn't a COVID symptom. So I got tested again, and that was, I think that was day 10. Because usually you do get worse from day 10 upwards. Yeah. So the scan, again, the swab came negative. So you have to know what symptoms you're having. I didn't have the taste bud symptoms. I did not have the aches, nothing at all. It was just headaches and then productive cough, which obviously were similar to the symptoms of COVID, but it was not COVID as stated. But there again, I have to self-isolate myself for at least 7 days. The reason is I didn't know what I was dealing with the 2 little girls in the house. I have to know when to be able to come close to them because I didn't want them to get anything. And my partner also had temperature. So again, I was thinking, oh God, that makes you think, oh, have I got the COVID symptoms? Like, have I got COVID? Because he had a bit of temperature. And again, he also got swabbed. His swab came negative as well on day 5. So I don't know what was going on. Mind you, if there is flu, everybody could get in the house as well. So it could be the flu, it could be the chest infection. It's something, obviously, but apparently it wasn't the COVID, even though I was having those symptoms. So after that, I had to come out of isolation and just join the family. It's really hard if you're living in a house with all these people. How do you isolate yourself? You know what I mean? Fortunately for me, I've got my bedroom. I had bathroom and toilet in there, so it was easy for me to do that. But if you're living in a house where you don't have that facility, where you have to share them, it's really, really hard. So that's why probably you all developed the same symptoms because you were sharing facilities in the house, isn't it?
Sorry, can I just add to just do a slight correction, Natasha, is that initially when COVID came out, no one understood it. Yeah. So there was slightly variation in how people were treated.
Yeah.
Now, once we understood more about it, there were risk assessment that was carried out with staff. So some people, we had quite a few staff who were home shielding and still is shielding based on the vulnerable group that they categorize themselves in. Because I've also got a colleague who is currently working from home based on this. And the 1st of June, she ain't going to be coming back until because she will still continue being shielded. So it's just initially there wasn't enough guidance in terms of what to do. But in NHS, yes, we've still been following, the general guidance for everybody else. If you live with vulnerable adults, etc., and your health condition as well, those things were taken into consideration. Even people who are pregnant have had to not be at work or be redeployed elsewhere. So it's so hence why I just wanted to correct that, because I know that you're not working in NHS, but I currently work in there, so we've been doing those precautions as well anyway.
Good.
The other thing, just to add in terms of as we wrap up, to add to the assessment, because there's now recognition that the BAME, the BAME community, is at higher risk than our Caucasian counterparts, that they've now there is a occupation, well, in the trust that I work at, there's a new OccuHealth risk assessment, which includes the BAME staff. So it's looking at, your age. So the criteria comes down. So if you're 55 and above, you are at high risk, and then it looks at your other comorbidities. So there is now that recognition also that we are at higher risk. With the COVID, with the easing of the lockdown and stuff.
Well, with me, I've gone into a different role, which is acting. I'm trying to put smile on people's faces.
You dare use this platform to advertise.
Put smile on people's faces, which seems to be working. And it's actually helping me, because it feels good to see people smiling and laughing. And that's what's taking my mind off this COVID issues at the moment, because I know that I'm able to, if not make somebody laugh, even if they're on hospital bed, they're also watching and they're laughing, and that will heal them quickly, because laughter is a good medicine, as they call it.
Yeah, that's true.
So I've gone into acting and singing. So that's what I'm doing at the moment. So a bit of acting.
Well, at the moment I'm just on the downward spiral now, because I was on a high. So now I'm actually starting to reflect, to just breathe, because before I wasn't able to breathe during COVID. So now I'm starting to breathe, if that makes sense. And then I'll decide what move to go next. But it's that path for me at the now is to get back into my zone, because I didn't have enough time or the mental capacity to take on certain things, like looking after myself. So now it's time to go back to looking after myself again.
I think it's just not that I haven't really been doing, like I say, I haven't been out there working, but I think it's more so focusing on my own health. My operation got cancelled throughout the pandemic, which is completely understandable. Lots of hospital appointments I've had have been cancelled. So it's just trying to get those things all back on track. So obviously for me, it's been a whole year out, personally, health-wise, because I've had to put things on standby. But that's fine, completely, like I say, understandable. And I think it's just appreciating life, really, because I've had a known of so many personal friends who have lost family members, not just statistics on the TV or patients, actually personal, one of which, couple doors down, a neighbour as well. So it's just trying to refocus, I think.
I think that's a good word. I think for me also it's about refocusing and finding myself, because during this period I've been eating quite a lot of food. Whilst everyone else has been exercising on Instagram and, do whatever, I was just eating and watching. So I just need to refocus and just get back on track, really, in terms of my own personal goals and stuff like that. So thank you for joining us again.
Thank you for having me. Thank you.